the shoulder. This is the anterior deltoid, the middle deltoid, and the posterior deltoid. The origin of these three muscles is the lateral 1/3 of the clavicle, the acromion process, and also the scapula. And then the insertion for all three is the deltoid tuberosity. The line of pull for the middle deltoid is abducting through the shoulder. Also, the anterior is flexing of the shoulder, medially rotation, horizontal abduction, and as well as the posterior rear deltoid. It extends the shoulder, laterally rotates the shoulder, and horizontally abducts. The line of pull goes towards the origin. And now I'm gonna palpitate the deltoid muscles. So this is for the anterior, the middle, and the posterior. The next two muscles we're gonna talk about is the latissimus dorsi and also the teres major. The teres major's insertion is the inferior angle and lower 1/3 lateral of the border of the scapula over here. The insertion is the crest of the lesser tubercle of the humerus. Next, the line of pull of the teres major is going towards the origin. The action of the teres major is extension of the shoulder, adduction of the shoulder, and medial rotation of the shoulder. Now I'm going to be palpating the teres major. Next muscle is going to be the latissimus dorsi. The origin, I don't have enough tape, so I'm just going to go with it. Latissimus dorsi's origin is the inferior angle of the scapula, also the spinous process, last 6 thoracic vertebral vertebrae, and also the last 4 or 3 ribs. The insertion of the latissimus dorsi is the intertubercular groove of the humerus. The action of the latissimus dorsi is extension of the shoulder, adduction of the shoulder, and also the medial rotation of the shoulder. Now I'm going to be palpating the muscle. It's this hole. Today we're going to talk about the muscles of the rotator cuff. The supraspinatus, the origin starts in the supraspinous fossa of the scapula. The origin is on the greater tubercle of the humerus. The action of the supraspinatus, it helps with abduction of the shoulder and also helps stabilize the head of the humerus. Now palpitating the muscle. Alright, now we're going to talk about the infraspinatus. The infraspinatus origin is the infraspinous fossa of the scapula, and also the insertion of the infraspinatus is the greater tubercle of the humerus. The line of pull goes towards the origin. I will also the action of the infraspinatus, it helps with lateral rotation of the shoulder, adduction of the shoulder, and also helps with the stabilization of the humerus, humerus. Also, the third muscle we'll be talking about is the teres minor. The origin of the teres minor is the upper 2/3 of the lateral border of the scapula. For here, the insertion is the greater tubercle of the humerus. The line of pull goes towards the origin. The action helps with lateral rotation of the shoulder, adduction of the shoulder, and also helps the stabilization of the humerus. Lastly, the subscapularis. The origin of the subscapularis is the subscapular fossa of the scapula. The insertion is the lesser tubercle of the humerus. The action helps with medial rotation of the shoulder, also stabilizing the head of the humerus. The line of pull goes towards the origin.